A topic that merits discussion and action for all Americans is long-term care. The issue is not new, but it's been growing in importance, especially in the last 10 or 20 years. Here's a basic description of the long-term care issues that need to be considered by virtually everyone. You see, for most Americans, when you reach age 65, your health care insurance is going to be the government's Medicare program. With Medicare, you will then be subject to the government's rules on your health care. You'll likely find these new rules to be quite different than what you may have been used to with other health care insurance coverage. Now, you may have heard about Medicare supplement insurance that's offered by many private insurance carriers. Well, one key fact you need to be aware of is that the Medicare rules on your health care are the main driver of what is covered by your Medicare supplement policy. Here's how it works. Medicare becomes your primary health care insurance at age 65. If you purchase a Medicare supplement policy from a private insurance carrier, the supplement will help you with paying your co-pays, deductibles, and co-insurance related to your Medicare coverage. In other words, if Medicare covers it, generally the supplement policy will help with the co-pays, deductibles, and co-insurance related to your Medicare claim. However, if Medicare doesn't cover something, generally neither will your Medicare supplement policy. Your supplement policy may offer some other benefits not covered by Medicare, but for the most part, the supplement policy serves to be a support to your Medicare coverage. If your health care need is not covered by Medicare or your supplement policy, then you're on your own to pay for your care out of your own pocket. In the government's Medicare program, there's something called Diagnostic Related Groups, or DRGs. The DRGs are the government rules about your health care. There are over 400 DRGs, and each is very specific on its rules for that particular condition or illness. The government's rules spell out exactly when you are considered to be sick, exactly what procedures are appropriate for you to get well, and exactly how long you can be in the hospital to receive this approved care. Now, if you don't do your part and get well on time, the hospital and the doctors involved ultimately have no choice but to move you out of the hospital to some other care facility. These other care facilities have many different names, such as rehabilitation center, long-term convalescent center, nursing home, and so on. But none of these care facilities are technically hospitals and fall into a broad category called long-term care. And if you need long-term care, Medicare will pay for some or all of the cost for a very short period of time. If your care needs extend beyond the time limits imposed by Medicare, you're simply on your own to pay out of your own pocket for your continuing care. The cost of facilities that fit in the category of long-term care can often run $4,000 to $6,000 per month per person, and sometimes even more, depending on the part of the country you are and the level of skilled care you're going to need. This kind of cost can make a big dent in any family's savings and investments, and these costs are rising rapidly, much faster than the rate of inflation on other goods and services. So what do you do? If you begin to pay out of your own pocket, how long will it be before you're dipping too far into your own funds, such that you're putting the financial stability and care of your healthy spouse in jeopardy? How long before your long-term financial future takes on a whole new and perhaps darker view? The cost of long-term care can be significant over time, and it can ruin or at least damage a lifetime of saving for a comfortable retirement. So, what are your options for addressing these escalating costs of long-term care? There are 5 basic options for you to consider, and these are: 1. Self-insure, or pay everything out of your own pocket. 2. Purchase long-term care insurance. 3. Use specially designed life insurance policies with long-term care features. 4. Use specially designed annuities with long-term care features. And number 5, some combination of all of the above. In another installment of the Financial Briefing, I'll share more about each of these options and what you need to note as you consider what is best for you and your family. Join us again soon for another installment of the Financial Briefing.